Royal fans were moved to tears by the surprising and deeply touching revelation from the Princess of Wales about what she will face during her cancer treatment in 2024. 2 years ago, when Princess Catherine first revealed her cancer diagnosis, the public's attention naturally focused on the illness itself and the treatment ahead. But now, more than a year after announcing that she was in remission, she has shared one of the most personal details of that journey, one that many people may never have expected. During a visit to the Christie Cancer Hospital in Manchester, the Princess of Wales spoke openly about a side effect of chemotherapy that made something as ordinary as reading almost impossible. Rather than describing physical pain, she talked about losing the ability to concentrate and focus, offering a glimpse into the mental challenges that often accompany cancer treatment. For someone known for her lifelong interest in books, education, and the arts, that admission carried particular weight. Speaking with cancer patients in an art therapy setting, Catherine explained that there was a period during the chemotherapy when she simply could not read or concentrate. Instead of forcing herself to complete difficult tasks, she discovered comfort in a surprisingly simple activity: coloring. She described it as something that allowed her to become absorbed in the moment without worrying about producing a finished result. There was no pressure to achieve anything. It simply offered a peaceful escape during an incredibly demanding period of her life. Many cancer patients experience cognitive changes during chemotherapy, often referred to informally as chemo brain or chemo fog. These symptoms can include difficulty concentrating, forgetfulness, slower thinking, and trouble maintaining attention. For many people outside the cancer community, these effects receive far less attention than hair loss, nausea, or fatigue. Yet for patients living through treatment, they can become some of the most frustrating and emotionally draining aspects of recovery. By describing her own experience so honestly, Catherine helped bring visibility to a challenge that many patients quietly endure. Her comments also reflected a recurring theme that has emerged throughout her public engagements since returning to royal duties. Rather than presenting recovery as a single moment when treatment ends, she has increasingly spoken about healing as a gradual process. Finishing chemotherapy, she has suggested on previous occasions, does not immediately mean returning to normal life. Physical recovery, emotional adjustment, and rebuilding confidence often continue long after hospital treatment is complete. That perspective resonated strongly during her conversations with patients at the Christie. Throughout much of modern royal history, members of the royal family have generally maintained considerable privacy around personal health matters. Catherine has respected that tradition by keeping details of her specific diagnosis private. Long before her cancer diagnosis, Catherine frequently promoted the importance of creative expression, particularly for children's emotional development, through the Royal Foundation Center for Early Childhood. Now, she has gradually become more willing to discuss the human experience surrounding illness, the uncertainty, the emotional impact, and now, the unexpected cognitive effects of chemotherapy. Her own experience has given that message an additional personal dimension. As Princess Catherine continues her gradual return to public duties, her role appears to be evolving in subtle but meaningful ways. She is not only supporting organizations connected with cancer care, mental well-being, and early childhood development. She is also helping broaden public understanding of what serious illness can actually look like, not just during treatment, but afterwards as well. Her latest comments remind audiences that recovery involves far more than physical healing. Sometimes, the biggest victories begin with something as simple as finding a quiet activity that allows the mind to rest when everything else feels overwhelming. And in sharing that deeply personal experience, Catherine has offered encouragement to countless patients who may have wondered whether their own struggles to concentrate, read, or simply think clearly were something they faced alone. Her message suggests they are not.